Scouts, Greg Muller here again. We're going to get started on our first aid merit badge today. Hopefully all of you have gotten yourself a merit badge book, because that's pretty much what we're going to be using here to teach everything. I'm going to be joined later today by a fellow by the name of Craig, and he's going to help demonstrate some of these practical skills. So we're going to get started on requirements here. Requirement 1 is satisfy your counselor that you have all the current knowledge of all first aid requirements for tenderfoot, second class, and first class. You can find those requirements on page 8 in your merit badge book here, assuming that we have the same version. I think mine is from 2015 printing, so not sure if it's not sure if there's a newer one that's the same or different, but looks like this anyway. It's this green thing on page 8. We're going to cover pretty much everything here, so I'm not going to go over them now, but after you're done with this merit badge, you will be able to satisfy all those requirements. Have a knowledge of all these things here listed for your rank advancement. Requirement number 2 is to do the following. Explain how you would obtain emergency medical assistance from your home on a wilderness camping trip and during an activity on open water. Define the term triage. Explain the steps necessary to assess and handle a medical emergency until help arrives. Explain the standard precautions as applied to blood-borne pathogens. Prepare a first aid kit for your home. Display and discuss its contents with your counselor. So we're going to dive right in here on page 11 in my book on how to handle an emergency. Even the best plans can fall apart. Accidents will happen. People will become sick. You might be the person who is most able to take charge of an emergency scene. Here is how you should proceed. Just a quick note here before we keep going there. It says the little green box here that says do your best. So Good Samaritan laws legally protect anyone making a good faith effort to help the victim of an injury or illness. Whenever you are confronted with a first aid emergency, use your skills to the best of your ability and training. No one expects you to have the knowledge of a physician. However, scouting's history is filled with stories of scouts who use their training to help others, sometimes even saving lives. All that means is if you do have to administer first aid to somebody, that means that the family can't come back and sue you if you're just making a good faith effort to help. So how to proceed in emergency here. Step 1 is check the scene. The site of an accident can be confusing, especially when serious injuries have occurred or there is more than one person involved. There are a number of things to consider. The hazard that caused the accident may still pose a threat. Seeing blood, broken bones, vomit, or people in pain might disturb bystanders and those trying to provide first aid. Before you take any action, stop for a moment to look over the scene and collect your thoughts. Consider the following questions. What caused the accident? Are there dangers in the area? How many victims are there and how badly are they injured? If there are other people nearby, can they assist with first aid or getting help? Will bystanders need guidance so that they do not become injured or ill themselves? Step 2 is call for help. Should you encounter a situation where someone has more than a minor illness or injury, act quickly to get emergency medical help. You can reach emergency services in much of the United States by calling 911. Some communities use other emergency alert systems such as dialing 0 or calling a local sheriff's office or fire department. Instruct a bystander or another first aider to call for help immediately. Tell them, says here to say, you call for help right now, then tell them where we are and what has happened, then report back to me. A wilderness camping trip can take you far from telephones. An injured scout who can walk on his own or with some support may be able to hike to a road. A group of scouts may be able to build a stretcher and carry a victim. For serious injuries, though, it is best to treat the victim at the accident site, providing that doing so would not further endanger the victim or the first aiders, and send 2 or more people for help. So what that means is move them if you have to, or if they're able to move on their own, or if leaving them where they are is going to be a further danger to them. Write a note containing the following information and send it with the messengers. The location of the victim, description of the injuries or illness, time the injuries or illness occurred, treatment the victim has received, number of people with the victim and their general skill level of first aid, Request for special assistance or equipment, including food, shelter, or care for non-victims. Activities on open water sometimes take people far from any help. Larger boats often have radio equipment that can be used to summon aid. When phones or radios are not available, however, passengers will need to make and carry out a plan for getting help. Such a plan might involve sending 2 people to the closest telephone to call for help. In case of an emergency, in the little box here, it says, many people carry mobile phones these days, but not everyone carries details of whom should be called on their behalf in case they are involved in a serious accident. If you add the acronym ICE for in case of emergency as a contact in your mobile phone, emergency workers can quickly find someone to notify about your condition. Ask your parent whom to list as your ICE contact. This is a really good idea. Something that I've done in my phone as well. ICE in case of emergency, so that way if something does happen and say you're not conscious, then they have a way to contact your emergency contact. For most people, it's their parents. So, number 3 here is to approach safely. After assessing the situation and summoning help, determine the best way to reach the injured person or persons. Perhaps an accident victim is laying on a busy highway or has fallen and tumbled partway down a mountainside. Will you also be in danger if you dash onto the highway or rush down the slope? Figure out a safe way to approach the victim or to remove the dangers from the area. Do not become an accident victim yourself. That's a big one. Don't become another victim. This is a big one that we teach for water safety. If you can't use your reach method to get to them, and you're not trained as a lifesaver, don't get in there and try to pull them out, because a lot of times drowning people will pull you underwater and then you both end up in trouble. So it says a couple of notes in the margins here is that mobile phones are unreliable in wilderness areas. If you take a mobile phone on an outing, have a backup plan for summoning emergency assistance. Good radio will work, satellite phone. We are going to show you in a little bit here how to improvise a stretcher, so we don't need to worry about that at the moment. Once you have figured out the safest way to approach, introduce yourself to injured persons and to bystanders. Assure them that the medical professionals have been called and are on the way. Speaking in a calm voice, explain that you are a scout trained in first aid and that you are there to help. Ask victims if they will allow you to assist them. If the victim is unconscious, you have implied consent to help them. If people are with an unconscious victim, be sure to tell them what you plan to do. If the victim is under 18, always get permission from a parent, guardian, or adult if one is present. Continue to speak to injured or ill persons as you administer first aid, keeping them informed of what you're doing. A person may appear to be unconscious, but may still be able to hear you. So keep talking in a calm voice. It helps keep the victim calm. Tell them what you're going to be doing. So, okay, I'm gonna apply some bandages to your leg here. Just talk out loud about what you're doing. Sometimes a victim's location threatens his or her safety and that of first aiders. So we kind of touched on that already here. If they're laying in a road and you can move them safely, move them. If they're halfway down the side of a cliff and you can get them back up safely, get them back up. We're going to talk a minute here about triage, because that is part of one of your requirements to understand what the definition of triage. Emergency situations involving more than one victim can require triage, quickly checking each victim for injuries or symptoms of illness and then determining how best to use the available first aid resources. So basically, if you come across a explosion or something and there's 6 people, you need to be able to tell which one needs your help first and what you have available to help them. So the blue box here about protecting yourself, I think it's going to touch a little bit more later on about blood-borne pathogens. But basically, in our first aid kits here at camp, right on top is always going to be a face mask, a pair of goggles, and rubber gloves. So you don't know what kind of illnesses or diseases somebody might have. So you always want to be careful about protecting yourself. Always use rubber gloves. A face mask and goggles if you have them available, or you can even just tie your handkerchief or your neckerchief around your face. You don't want anybody with like a bad bleed to get it in your eyes or mouth. So providing step 4 here is to provide urgent treatment. Breathing and bleeding. These are your immediate concerns when treating a victim of an accident or illness. Victims who have stopped breathing or are bleeding severely are called hurry cases because their lives are in immediate danger. They require smart, timely action on the part of a first aider. Whenever you come upon an injured person, take no more than 15 to 20 seconds to do a quick survey of his or her condition to find out the following. Are they awake, or are they conscious and breathing? If they appear to be unconscious, tap them on the shoulder. Don't shake them because you don't know if they have any head or neck injuries. They do not respond and they're not breathing, stabilize the head and neck, and perform compressions only CPR. They don't even really teach to give the breaths with the CPR anymore. For first responders, you can if you're trained to do so, and everybody should get trained in CPR and be CPR certified. Is there severe bleeding? So open up rain gear and outer clothing that might hide wounds from a view. I know in the military they do what they call a glove check. So they'll run their hands like under a jacket or on their back, say, and then check your glove and see if there's any blood on it. Are there other contributing factors? So look for medical ID bracelet, necklace, or card that might give information about allergies, diabetes, or other possible causes of an emergency situation. Persons who have asthma or allergies to insect stings or certain foods might carry treatment for their conditions, such as an EpiPen. I have a training EpiPen. I'll show you guys how to use an EpiPen. It's also pretty clearly labeled on the outside, but I'll show you. Number 5, protect from further injury. An important part of first aid is protecting an accident victim from further injury. Follow these guidelines. We kind of talked about that. Don't move them unless you have to, or if they're able to move themselves. Stabilize their head and neck. If they have a broken neck and they move their neck, they can sever their spinal cord or cause paralysis, so that's always a big one. While awaiting emergency personnel, support the victim's head in the position you found it, in line with the person's body. Number 6, treat every accident victim for shock. The circulatory system of a person who is injured or under great stress might not provide enough blood and oxygen to the tissues of the body. This condition is called shock, and it can be deadly as organs begin to fail. A shock victim can have some, all, or none of the following symptoms: restless or irritability, a feeling of weakness, confusion, fear, dizziness, skin that is moist, clammy, cool, and pale, a quick, weak pulse, rapid, shallow, or irregular breathing, nausea and vomiting, or extreme thirst. Serious injuries and sudden illnesses are almost always accompanied by some degree of shock, but the victim might not be affected right away. Treat every accident victim for shock even if no symptoms appear. Prompt first aid may prevent shock from setting in. Fear and uncertainty can increase shock, so just like we talked about before, talk to them in a calm voice. Try to keep them calm. First aid for shock. There's 5 steps here. Try to eliminate the causes of shock by restoring breathing and circulation, controlling bleeding, relieving severe pain, and treating wounds. Call or send someone for help. Monitor the victim closely to make sure the airway stays open for breathing. If the victim is not already doing so, help the injured person lie down. If you do not suspect back, neck, or head injuries or fractures in the hip or leg, raise the feet about 12 inches to move blood from the legs to the vital organs. Keep the victim warm with blankets, coats, or sleeping bags. So yeah, keep them calm, get them to lie down, elevate the feet, and keep them warm. Number 7 is make a thorough examination. By the time that you have dealt with urgent conditions and provided treatment for shock, medical professionals are likely to have arrived. When their arrival is delayed or the location will require greater travel time, conduct a more thorough examination to be sure you have found all the victim's injuries that require attention. If the victim is alert, ask them where it hurts and whether or not they can move their arms and legs. So for that, we look for secondary examination. We look for DOTS. It's called DOTS is the acronym. You look for deformity. So like if your arm's broken at a weird and bent at a weird angle, that's a deformity. Open wounds, tenderness, and swelling. It's a little hard to tell tenderness if they're unconscious, obviously, because they can't tell you it hurts. But check for swelling. There might be some bruising, that kind of thing. So number 8, plan a course of action. After conducting the examination, determine what to do next. The best course of action in most cases is to make the victim comfortable and continue to wait for medical help to arrive. Maintain treatment for shock, keep the airway open, monitor them for changes, and be ready to provide any other treatment that the victim may require. If you're in the backcountry and it's going to be a while, set up a shelter or tent. If they are injured and can't get into the tent, they can always, I'm not sure if it even teaches it in this book, but oh yeah, it does. Okay, so if they can't scoot themselves into the tent because of their injury, you can just cut the floor out of the tent, put it over them, or cut a slit in the floor and put it over them. to keep them, especially if they're getting rained on and they're getting hypothermic or something. Learn all the first aid you can and review it often. Perhaps one day you'll be able to do the right thing at the right time, and your actions will make all the difference. So. All right, we're going to talk about first aid supplies and skills. That's going to be for 2D here. I'll let you guys review this. Standard stuff for the first aid kit that you have to put together. And that is prepare your first aid kit, display and discuss its contents with your counselor. So any requirements on this merit badge is going to be sent into the virtual camp email that you guys got this video and such on. So always make sure to take a picture of any requirements, that is stuff that you guys have to do that's not just listening to me talk. So preparing the first aid kit is an example of that. You guys will have to put together a first aid kit. Use the list on page 21. Make sure that you're familiar with everything that's in it. Snap a picture of it and email that in so I can check off that requirement for you. Move on to moving an ill or injured person. The decision to move an accident victim should be made carefully. In many cases, there will be emergency medical crews, fire department personnel, or others with special equipment and training who will transport an injured person. If, however, someone is in danger from fire, smoke, water, electrical, poisonous gases, exposure, or other immediate dangers, you must move that person to safety. You might also need to move an injured person in order to give that person proper care or reach another victim. Move the person only as far as is necessary and do not endanger yourself. If they can move themselves, let them move themselves. So before you move them, make sure they're not suffering from shock, heart attack, head, neck, or back injury, frostbitten or burned feet, bone or joint injury at the hips or below. You don't want them walking on a broken hip. So, for a victim of a venomous bite or sting, getting the victim to medical attention is the most important goal. This may call for moving the victim before the swelling becomes too severe. If the bite is on an arm or a leg, try to minimize movement of this extremity as much as possible. And then it's going to go over a few different ways to move people in these next couple of pages here, so I'll let you guys review those. If you can, and say if you have a younger sibling or one of your friends and you can do this safely, you should practice any of these that you feel safe doing or are able to do. If you have several people, you can do the multiple rescue or assists. Rescue from a smoke-filled room. A smoke-filled room is an extremely hazardous environment. Rushing into a smoke-filled room or other dangerous scene to help someone will do no good if you also become the victim. If your safety will be threatened, wait until trained rescuers arrive. Make sure to move them quickly. And then, let's see, it shows a couple of ways to improvise a stretcher here. We're going to pause here a minute. I'm going to go get one of the stretchers that we use here at camp and then show you how to improvise a stretcher at camp. Alright, so this is our stretcher, one of the ones that we use out here at camp. This is a foldable one. So these are usually pretty self-explanatory, just kind of unfolds and locks into place kind of like an extension ladder on the bottom. So if you can find one that's already made, like a professionally made stretcher, do that. But if you don't, we're going to fold this up. Then we can make one out of a blanket and a couple of sticks. Here we're going to use 2x4s because that's what I have. Alright, 2x. So I'm going to show you here, see if you can see the end of it. There we go. So you can see how you wrap the blanket. So you start, I have the blanket folded in half just because it's easier for me to move around, but you would have it folded the length of your boards. So then we'll lay the first stick on. And then, fold your side over. Lay the second stick on. And this comes back over the top. So that way they're laying on everything so it won't come unraveled. Last year when we taught this, we put me on it, so we know for a fact it'll...
So I'm just holding up this end. If you want to just push down on the center, show how it kind of binds on itself.
Yep, see, the blanket won't unravel from itself. So you can also take a t-shirt. It's in your book, 28 here. It shows in your book how you can use a couple of t-shirts. It's pretty self-explanatory. You stick the arms of the t-shirt through, one on each end, and they can lay on that. If you have a backboard available, you can use that. So these are just a couple of things that make it easier for you to transport somebody. And again, we're only doing that when it's completely necessary to get them out of the way of danger, or if they have a life-threatening injury. So we will be right back. Alright, we're going to talk about first aid for severe bleeding while I still have Craig here, because this is a lot easier to demonstrate with a second person. So step one is going to be to put your non-latex disposable gloves on. They say non-latex because there is a fair amount of the population that's allergic to latex. Even if you're not, the person you're working on might be. So these are nitrile gloves, non-latex, and it says protective goggles. This is a face mask that actually has an eye shield, or you can put on goggles. For a case of severe bleeding, I'm going to want to kind of cover my face anyway, so this is one I'm going to use, or would be using. And it just has ear loops. I'm sure people now are a little bit more used to wearing masks than we used to be, but that must be a kid-sized mask.
Mm-hmm.
Okay, so that'll keep anything out of my eyes, anything out of my mouth. And then we're going to use, this is a big surgical dressing, or any piece of big gauze pad. If you only have little gauze pads, get a bunch of them. We're going to use Craig's arm here again. And he's gloved up because he's going to show you the proper way to take them off. He's got better training on that than I do. So, alright, big surgical pad. Again, we're going to use this scar as a reference. Going to put lots of pressure on it, and we're going to put the arm above the level of his heart, or even better, where we would put it above his head. And what that does is draw some of the blood out of the arm. That helps to keep get the bleeding under control, and maintain pressure like this until the bleeding stops or slows down significantly. And then if you have, again, we can use our triangle bandage or a bandana, but like elastic wrap and ace bandage would work even better, and because that'll help keep some pressure on it. And then you want to get them to help as soon as you can. Now the big one here, I'm going to take the camera from Craig here and let him show you how to take the gloves off the right way so that you're not contaminating your clean hands. So
Okay, so we've got bloody, dirty gloves. So when we remove those, we are going to want to lift up with this, and this blood that's down in the cup of my hand, we're going to want to keep that contained. So now we have the inside of the glove on the outside. We're going to use this glove to hold on to this, and we're going to do the same thing with this to remove it. And that way we're only touching the inside of the glove that our hands touched, and the blood and other debris matter is contained inside the glove.
alright, getting back into it here now, we're going to talk about the early signs and symptoms of a heart attack and a stroke. Heart attack is a life-threatening condition that causes death of or damage to the heart muscle. When an artery that supplies blood to the heart is blocked, a heart attack can occur. A heart attack requires quick action to possibly save a life. Learn to recognize the warning signals of a heart attack, then be prepared to take prompt action by calling 911 or the local emergency response number. Immediately administer CPR if necessary. If somebody stops breathing, CPR. Doesn't matter if their heart stopped. If they stop breathing, CPR. Because if they've stopped breathing, the heart's not far behind it. So here are some of the common warning signals of a heart attack. Persistent uncomfortable pressure, squeezing, fullness, or pain in the center of the chest behind the breastbone. It may last several minutes or longer and may come and go. It needs not to be severe. Pain spreading to the shoulders, arms, neck, or jaw. Unusual sweating, for instance, perspiring even though the room is cool. Nausea, which is stomach distress or urge to vomit. Shortness of breath, and a feeling of weakness. Should anyone complain of these symptoms, call 911 to get medical attention for the victim right away. Be aware that a common reaction of men and women who are experiencing signals of heart attack is to deny that anything is wrong. Be ready to begin CPR if the heartbeat and breathing stop. Women may experience different symptoms than men. Women might also have intermittent back, abdominal, and upper body pain, unexplained fatigue, and dizziness. She might feel heaviness in the chest or a burning sensation rather than pain. If you suspect somebody of having a heart attack and this person is conscious, try to do the following. Try to find out the following. Is the person taking any type of blood thinning medication? Is the person allergic to aspirin? Does this person have stomach problems? Has this person ever been advised by a physician not to take aspirin? If the answer is no to all of the above questions, when you call 911, administer 2 uncoated baby aspirins, 81 milligrams apiece. Aspirin may be used, not painkillers such as ibuprofen or Tylenol, or acetaminophen, which is Tylenol. Signs of a stroke. So a stroke is also called a brain attack. Occurs when an artery to the brain either bursts or is blocked by a clot. When blood supply to the brain is interrupted, brain cells begin to die. Common warning signs. This disease injures the brain and signals happen fast. The victim might not be aware a stroke is occurring. Others nearby might not know it either. This is why it is so important to know the common warning signals of a stroke. Sudden weakness or numbness of the face, arm, or leg, especially if it's one side of the body. Sudden confusion or trouble speaking or understanding speech. Sudden trouble seeing. Sudden dizziness with loss of balance or coordination and trouble walking. Sudden and severe headache with no known cause. So for a stroke, we use the FAST acronym, F-A-S-T, FAST. And that stands for face, so you ask them to smile. And if their smile is uneven, that can be a sign. Or if it's drooping on one side, I know you can't see because of the beard, but if it's drooping on one side. A is for arm, ask them to raise both of their arms and watch for any weakness or numbing of the arm. So it is like they think they're holding their arms out straight, but one's actually lower than the other. Speech, ask the person to say a simple sentence such as, "May I have a cookie?" They might sound intoxicated or have trouble enunciating the words. And time. So it's time to call 911 right away if the person cannot perform any one of the simple tasks above or shows any other signals of a stroke. Be sure to note when the stroke began. We do that because it's called they call it the magic hour, the golden hour. If a person having a stroke gets to the hospital and gets treatment within an hour, they have a lot less chance of having any permanent disabilities. So I don't know if you guys have ever seen somebody or know somebody that has had a stroke in the past that might have some numbness or paralysis on one half of their body. Something you guys could look up on the old Google machine if you were curious about what that might look like. So we're going to move on. A lot of these minor wounds and injuries following the order of my book here. Describe the symptoms, proper first aid procedures, and possible prevention measures for the following conditions. Bruises. Bruises are a black and blue mark. It is blood that leaks into the skin tissue, usually from the blow of like a blunt object. I'm sure we've all had bruises, so you're familiar there. But the treatment for a bruise is just to place some ice or a damp cloth on it for 20 minutes. So you can do 20 minutes on, 20 minutes off, just like you would do for a sprain. It'll slow the blood leaking into the tissues. Bruises aren't usually too severe. I get some nasty bruises or nasty strikes sometimes from a blunt object. I don't usually treat them, but you certainly can. Puncture wounds. It shows you here how to remove a fish hook. So we're not gonna go over that. But puncture wounds can be caused by pins, splinters, nails, or fish hooks. They all can be dangerous because a puncture wound is hard to clean out just because of the nature of the wound. So they might get infected. Cuts and scrapes or abrasions. They can be caused by knives, razors, or broken glass. An abrasion is a wound that occurs as a result of the outer layers of the skin being rubbed or scraped off. Like if you ever fallen off your bike and skinned your knee, gotten some road rash or something, you guys know how bad that can hurt. I've had some bad road rash in my life. I was in a motorcycle accident when I was younger, so it's very uncomfortable. To prevent it, you just dress appropriately. So I was not wearing a leather jacket when I got in my motorcycle accident when I should have been. So that's I could have prevented it. To treat it, you just flush it with water for at least 5 minutes or until all foreign matter appears to be washed away. You may need to scrub the area gently, apply triple antibiotic ointment if they're not allergic to it, and then cover with a dry, sterile dressing and bandage or an adhesive bandage. Anytime you're putting a bandage on, make sure you're not putting it on too tightly. That's a big mistake that a lot of people make. It cuts off the blood supply, cause more injury. To dress and bandage a wound, use a dressing large enough to extend an inch or more beyond the edge of the wound. Hold the dressing over the wound and lower it directly into place. If the dressing slips onto the surrounding skin before it has been anchored, discard it and use a fresh dressing. We do that to make sure that it's still sanitary. Blisters. Blisters are pockets of fluid that form when skin is injured by friction. I assume most of you have probably had a blister in your life. I certainly have had a lot of blisters. I get them on my hands more than anything because I'm pretty bad about wearing gloves when I'm doing a lot of, like, say, hammering or digging with a shovel. So, and they're common among backpackers and hikers. I used to get them pretty bad on my feet when I was camping, when I was at camp, when I was a scout. So, to treat a blister, you can use moleskin, or I've been known to take a piece of duct tape and put it over a hot spot because that will rub the duct tape instead of your blister. Basically, just keep it covered. All right, there's a brief section here about blood-borne pathogens. I know I kind of touched on that when I talked about wearing your rubber gloves, but the recommendations from the BSA are to treat all blood as if it were contaminated with blood-borne pathogens, thoroughly wash your hands with soap and warm water before and after treating a sick or injured person, never use your bare hands to stop bleeding, use a protective barrier, preferably non-latex disposable gloves. You can also use, say, a zip-top bag out of your kitchen. That'll work in a pinch. Safely discard all soiled gloves, bandages, dressings, and other first aid items by putting them in a double bag and then until they can be disposed of properly in a biohazard receptacle. And always wash your hands and other exposed skin with soap and warm water or an alcohol-based hand sanitizer immediately after treating a victim, even if protective equipment was used. That's just a redundancy to make sure that if you're wearing gloves and you get a little spot of blood on your arm or something that you don't see. So it says here, in some situations, such as a life-threatening one, it might not be possible or practical to spend 15 or 20 seconds washing your hands. This is a judgment call that you guys will all have to make as individuals. If I see somebody personally, if I see somebody bleeding to death, I'm not going to stop to go try to find gloves or wash my hands. Me personally, I'm willing to accept the risk of a blood-borne pathogen if somebody's going to die. So, but that's a judgment call and ones that you have to make individually. So moving on to muscle, joint, and bone injuries. Muscle cramps. Muscle cramp occurs when the muscle contracts on its own and does not easily relax. They tend to happen most while the body is fatigued and when muscles have not been stretched well. Dehydration, exertion in hot weather, and depletion of electrolytes in the body may also lead to muscle cramping. With severe cramping, the muscles may feel hard and knotted. Allow a person experiencing muscle cramps to rest. Often a cramp will disappear on its own in a few minutes. To help recover, you can gently massage the muscle and lightly stretch. If the weather is warm and the person has been exercising, be sure the person rehydrates with water or ideally sports drink that will help the body and restore its proper electrolyte balance. You can decrease the likelihood of muscle cramps by staying in good physical shape, stretching before exercising, warming down, and drinking plenty of fluids before, during, and after your workout. I don't know if you guys have ever had muscle cramps in your feet, but it's a pretty painful thing that I can get it by every once in a while if I'm dehydrated and have done like a lot of hiking or climbing ladders or something. So they're painful, but treat them how I talked about here. So sprains and strains. A sprain occurs when an ankle, wrist, or other joint is bent far enough to overstretch the ligaments, the tough bands that hold the joints together. Twisting an ankle while running is one way a person can sustain a sprain. A strain occurs when the muscles are overstretched, creating small tears in the muscle fibers. Lower back pain is often the result of muscles strained by overuse or by lifting loads that are too heavy. Minor sprains and strains cause only mild discomfort, but more serious sprains and strains may be temporarily disabling. A sprained joint will be tender and painful when moved and might show swelling and discoloration. Strained backs, arms, and legs will also be tender and can hurt if activity continues. Assume that any injury to a joint may also include a bone fracture. Use the following procedure to treat sprains and strains and prevent further injury. Have the victim take any weight off of the injured joint and instruct the person not to use the joint. Do not try to move or straighten an injured limb. Cover any open wounds with a sterile dressing. Apply ice packs or cold compresses to the affected area for no more than 20 minutes at a time. Like I said with a bruise, 20 minutes on, 20 minutes off. We do that to prevent frostbite. It's the freezing of your skin cells. I've had frostbite, and not severe frostbite where my toes turn black and fall off, but I've had frostbite where the skin peeled off and it's painful. So always be mindful of that. For any bone, joint, or muscle injuries, we use the RICE method, or the RICE acronym. R stands for rest, stop using the injured part or minimize its use. I stands for ice, 20 minutes on, 20 minutes off. C stands for compression, apply an elastic bandage to reduce swelling. And E is for elevation. If possible, keep the injured part above the level of the heart to reduce swelling and pain. It's harder for your ankle to swell up if it's, above your heart. So, and the swelling does cause more discomfort, so always a good idea. All right, we're going to demonstrate here how to tie up an ankle for a sprained ankle, something that happens pretty regularly on a camp setting here because we do a lot of hiking. So I have a triangle bandage. A lot of your first aid kits will have these in them. The one you put together should have one. They're useful for a lot of things, so kind of show you the whole thing here. So we'll take this, say leave it about 3 inches, and kind of roll it up here. Alright, and we're going to go down here to a foot that's not mine. So Craig has just sprained his ankle out on the trail. We're going to leave the shoe on and tightly tied. This is part of what helps secure this. So with your bandage here, we're going to go underneath by the heel, or right across the arch like this, around the back. Keeping everything lined up. You go around once, and then when you come through the back the second time, you're going to pass your end underneath this loop that you created. Same thing on that side. And then tie it down across the top using just a square knot. So that's going to give support to the ankle, and as long as they're comfortable walking on it, that'll help you get off the trail. Alright, moving on to broken bones. A fall, a violent blow, a collision, all of these things can cause a fracture or broken bone. When you suspect a fracture, do not move the person. Check DOTS, D-O-T-S. So that's the deformity, open wound, tenderness, and swelling. Ask the victim if they heard or felt a bone snap. Do you feel pain when you press on the skin above the suspected fracture? Are you able to move the injured limb? So if the victim answers yes, that person has a likely fracture. Before administering first aid, you should try to obtain the victim's consent. If the victim is unconscious, disoriented, or otherwise appears unable to knowingly grant consent, you can assume it is all right to proceed. We talked about the Good Samaritan laws to protect you in that case. A couple of different kinds of fractures here. A closed or simple fracture is a broken bone that does not cut through the skin. For a closed fracture, you call 911. You treat any of your hurry cases. Hurry cases are the ones that are life-threatening. Protect the spinal column by supporting the victim's head and neck in the position you found it, and treat for shock. An open or compound fracture is a fracture in which the bone has poked up through the skin. To treat that, you call 911, treat your hurry cases, protect the spinal column, and then you move on to controlling bleeding by placing a sterile gauze around the wound as you would for an embedded object. Do not use direct pressure, as that could move the bone. Do not try to clean the wound, and treat for shock. Whether it's an open or a closed fracture, leave them where you found them. Even if it's leave them where you found them, unless it's in a dangerous situation and you have to move them, which we covered. The saying "splint it where it lies" is usually good advice. Don't try to straighten their arm out if it's at a bad angle from a break. Just splint it the way it is to keep it from moving. And don't try to stick the bone back in. Alright, now we're going to show you how to splint an injured limb. This is on page 43. So, step one is to keep the area above and below the injury still and stable. Check for circulation. So, we're going to he's got a broken arm right here. We're going to pinch the fingertips and see if the color comes back. His hand's warm, so we know he has circulation. Extend the splints above and below the injury site. And again, we're using our triangle bandages here that I have rolled up. And I'm going to use 2 of them in this case. So we're going to use this scar as a reference because that's where Mr. Craig broke his arm the last time he broke his arm. And so we're going to want to splint above and below. So we're going to tie it down close to his hand for the first one. If you don't have triangle bandages, of course you can use your neckerchief, your bandana, your handkerchief, shirts, you know, some long socks, whatever you got that's a softer fabric. We don't want to use like rope or duct tape usually, because that's going to cut off the circulation. So we'll do it till it's not going to move anywhere, but not any tighter than that. I suppose it'd probably be helpful if I put the other stick in. Alright. There we go. One on each side so it's stabilized. And I'm just using like a simple square knot for this, but about anything you use will work as long as it keeps it tied firm, but again, not too tight. So there's that stabilized. And then after you have your splint in place, we're going to recheck for circulation. Hands and fingertips are still warm, still got color coming back. So that is a good splint, and then you keep that in place until the medical professional removes it.